Welcome to Fisher-Titus Medical Center's new Surgical Services Department. Since spring of 2013, our teams have been busy creating a new level of excellence in surgical services at Fisher-Titus. Our Surgical Services Department is designed to offer the best in patient care, focusing on safety, privacy, comfort, and efficiency, serving our community now and into the future. When you are scheduled for surgery, most of your pre-op work is completed before your procedure in our pre-admission testing unit. This unit is conveniently located inside our admitting area. The same entrance you will use on the day of your surgery. On the day of your surgery, simply check in at the registration desk, and you will be escorted to the surgery seating area, where your family and friends will relax while your surgery takes place. Our surgery seating room includes a reception area, a comfort station with coffee, tea, and snacks, a television, restrooms, and a children's play area. A hospital volunteer will be on hand to assist you while you are there. The room also features a patient tracking board, so your family members can monitor your progress from surgery to recovery. After your procedure, your surgeon will meet with your family members in a nearby consultation room to review the surgical details and provide in-home care instructions. From the surgery seating room, you will be taken to the prep and recovery area to prepare for your surgery. 2 family members can accompany you there. If you're having minor surgery that does not require anesthesia, you'll be prepped in our minor surgery prep room and treated in our minor treatment operating room. Both of these areas are very close to the entrance of the surgery suite to help you quickly proceed through the process. If your procedure requires anesthesia, you will be assigned to one of 16 private rooms that are situated around 2 nurses' stations and a central area for medications, nourishment, and supplies. Each room is equipped with a television, bed, and the latest medical equipment and technology. Here, you'll be greeted and prepped by members of your surgical team. Family members accompanying you can stay with you in the room until it's time for surgery. Once you are prepped for surgery, you will be taken to one of 7 operating rooms, where you'll experience a calming atmosphere with soft music and visuals created by our patient greeting system. All of our operating rooms contain the latest in technological advancements and have the ability to synchronize and integrate important patient information for the physicians and surgical team. Much of the equipment in our operating rooms is suspended and away from the floors, making it safer for patients and more efficient for our surgical staff. Monitors within the room provide important images such as X-rays, MRI scans, and ECGs. And cameras within the rooms allow staff at the surgery control desk and physician areas to monitor surgeries. Another camera captures still shots that can be stored in your electronic medical record. Each operating room includes cabinets with warm blankets and fresh gowns. And pass-through doors to the central sterile core have been built into the space, so nurses never have to leave the room for items they may need. A special floor in one of the operating rooms supports our Da Vinci surgical technology, where highly skilled surgeons guide a state-of-the-art robot for minimally invasive surgeries. Behind the scenes, our clinical team spent many hours researching best practices for managing our surgical supply inventory, The central sterile processing area performs the crucial function of collecting and sterilizing instruments and supplies before assembling, packing, and restocking equipment in the central sterile supply core. Here, the staff can efficiently pull supplies needed for an operating room setup. Outside the operating rooms is the frozen section room that medical pathologists can easily access to perform microscopic and gross visual analysis of surgical specimens, providing surgeons important early clinical findings. Following your surgery, you will go to a Stage 1 recovery room in our post-anesthesia care unit. This area's open concept gives nurses optimum visibility to recovering patients, while wing walls provide patient privacy. Vital sign monitors are strategically placed so nurses can closely observe 2 patients at the same time. There are also 2 private rooms with doors for isolation patients, as well as pediatric patients, allowing parents to be with their children during this stage of recovery. An observation window at the nurse's desk allows for easy monitoring of patients. Once you are alert and your vital signs are stable, you will move to the second stage of your recovery, in the same room where you were prepped before surgery. Your family members will be able to rejoin you here. Nurses will monitor your vital signs and provide you with pain medications if needed. You will be able to have a snack, and when ready, your nurse will review your discharge instructions with you and your family. Once ready, you will be escorted by a nurse to the covered patient pickup area, where family members can easily assist you into a vehicle for your trip home. Thank you for touring our new Surgical Services Department. Fisher-Titus Medical Center. Simply smarter care.